The transition from medical school to residency is a big one. When a learner has a disability, this transition means navigating accommodations as a trainee who is also an employee. In this video, we will review the steps to disclosing a disability and requesting reasonable accommodations. Our hope is that at the conclusion of this video, viewers are able to define what disclosure of a disability means in residency or fellowship, illustrate reasonable accommodations in GME, identify the benefits of timely disability disclosure. We recommend that new residents disclose disability prior to starting their residency training so that accommodations can be in place starting day one, ideally prior to matriculation. You might be asking yourself, how do I disclose in residency? Even if you had accommodations in med school, you need to understand how this process is different as a resident trainee. Let's talk this through. How you pursue accommodations as a resident may be different than when you were a medical student, starting with how you disclose and to whom. Instead of looking for the Student Disability Center, you will be engaging with an ADA specialist. The ADA specialist may be located in the HR, Human Resources offices, Occupational Health office, or Disability Management Services office, depending on the institution. In the interactive process, the ADA specialist will work with you, collecting information about your disability-related needs and your documentation and history of disability. Then the ADA specialist will work with your program director to discuss the accommodations and to determine if they are reasonable in the context of the program requirements. The goal is for all parties to work together to develop an accommodation plan that ensures equal access for you, the resident. Residents should find out about how to contact the person who oversees disability accommodation in a welcome letter or as part of the orientation. This information should also be included in the resident or house staff handbook. Unfortunately, you may not get any information about the process. In fact, a 2020 study showed that 32% of GME programs reviewed did not include a disability policy, even though it is required by the Accreditation Council for Graduate Medical Education. You can also use the search tool on your institutional website to search for disability policy or accommodation policy. If you are unable to find this information in your handbook or online, you may have to contact the program and directly ask for information. You are in control of the process and may be wondering, where do I start? What information do I need? Am I ready to disclose? Reaching out to an ADA specialist is confidential and is an opportunity for you to gather important information about the process. Telling your institution about your disability is a form of disclosure, and in response, your institution should begin a conversation about whether or not you require accommodations to fully access your training program. Remember, the specifics of your disability do not need to be shared with your program director, by you, or by the ADA specialist. The only information that should be shared is the resident's functional limitation, the resulting barrier in the training environment, and the required or requested accommodations. Training programs have different levels of experience with disability accommodations. Unfortunately, you may find yourself in a training program with limited experience working with residents with disabilities. In these cases, self-advocacy will be important. As the employee, you are responsible for declaring your disability and requesting accommodations. It may be helpful to come to this process with some accommodations in mind. When determining whether an accommodation is reasonable, the program will engage in several steps. Step 1. Determine disability status. Step 2. Identify the functional limitations. Step 3. Identify barriers that exist in the training environment. And Step 4. Determine reasonable accommodations. Unlike in medical school, where you might receive counsel on what is needed, employees must determine their own needs and ask for these specifically. To figure out your disability-related needs and potential accommodations, it may be helpful to look at the stories of other physicians with disabilities. consider looking at the Docs with Disabilities hashtag on social media, or listening to the Docs with Disabilities podcast to hear stories of other physicians and their advice for navigating GME. As a part of the decision-making process about accommodations, the ADA specialist will need to consider the essential functions of your role and the residency, as well as the size of the program and its service needs. Additionally, any ACGME milestones and board requirements will need to be considered. The following are examples of potential reasonable accommodations in residency: protected time for disability-related appointments, extra time on in-service and board exams, sign language interpreter, specialized equipment, extending residency with reduced hours, weekend daytime call in lieu of overnight call. Finally, timely disclosure of a disability or disabilities is important. New residents sometimes consider a wait-and-see approach to pursuing accommodations. Establishing accommodations takes time, whether you're new to the institution or not. Without accommodations, you risk not having full access to your training program. Studies show that lack of program access carries implications for residents, including increased risk of depression symptoms and self-reported medical errors. Importantly, without program access, your performance will be evaluated and documented in a way that is not reflective of your abilities. Accommodations are never applied retroactively. Therefore, it is in your best interest as a resident to disclose and request accommodations early in the process. Let's discuss the 5 steps for requesting accommodations as you transition to residency. Step 1. After match day or the onset of a new disability, contact the ADA specialist at your institution. Step 2. Provide the necessary disability documentation to the ADA specialist. Be sure to let them know about any history of accommodation that was effective in removing barriers. Step 3. The ADA specialist will engage in the interactive process with your program director to help determine reasonable accommodations. Step 4. Together, you will review the proposed accommodation and provide feedback. If needed, steps 2 through 4 can occur multiple times before you get to an agreed-upon plan. Step 5. After review, if all parties agree, the accommodation is implemented. As a resident with a disability, you can find a community via social media using the hashtag #DocsWithDisabilities. We also encourage you to investigate the additional resources available on our Disability in Graduate Medical Education website at www.docswithdisabilities.org/DIGME.